This is the skin and sense organs, starting on page 261 with anatomy. Our images show at the top, we have an image of how the skin is broken down. At the bottom, we have a hair follicle. We also have a nail bed on a finger. On page 262, we have an image of the eye and all of the parts of the eye. And then on page 263, we have the parts of an ear, the external, middle, and inner. The skin and sense organs receive messages, touch sensations, light waves, sound waves from the environment and send them to the brain via nerves. These messages are interpreted in the brain, making sight, hearing, and tactile or touch perception of the environment possible. Our terminology: cutaneo means skin, so subcutaneous is the lower layer of the skin composed of fatty tissue. Dermo means skin as well. Epidermis is the outer layer of the skin. Dermato also means skin, so dermatology, study of the skin and its diseases. Onycho means nail. Onycholysis is separation of a nail from its foundation or bed. Unguo is also nail. Subungual is pertaining to under a nail. Pilo is hair. Pilosebaceous, pertaining to hair and its associated sebaceous gland. Tricho is also hair. Trichotillomania is obsessive-compulsive disorder marked by the urge to pull out one's hair. Oculo means eye, so ocular is pertaining to the eye. Ophthalmo also means eye. Ophthalmoscope, an instrument used to visually examine the eye. Phaco is the lens of the eye, so aphakia, absence of the lens of an eye. Retino means retina. Retinopathy, disease of the retina. Oro means ear. Oral discharge, fluid or material from the ear. Auto is ear. Otitis, inflammation of an ear. Myringo means eardrum. Myringotomy, incision of the eardrum. Tympano is also eardrum. Tympanoplasty, surgical repair of the eardrum. Next we have our pathology section. Alopecia is absence of hair from areas where it normally grows, baldness. Cataract is clouding or opacity of the lens of the eye, causing impairment of vision or blindness. Conjunctivitis, inflammation of the conjunctiva. Glaucoma, increase in pressure, fluid accumulation within the chamber at the front of the eye. Melanoma, malignant tumor of pigmented cells that arises from a nevus, a benign mole in the skin. A nevus is a pigmented lesion, non-malignant, in or on the skin, also known as a mole. A stye is a pus-filled, purulent infection of glands near the eyelid, most often caused by bacteria, also called hordeolum. And tinnitus, abnormal noise such as ringing, buzzing, or roaring sound in the ears. Our laboratory tests and diagnostic procedures. Allergy test procedure in which allergy-causing substances are placed on the skin and a reaction is noted. In the patch test, a patch with a suspected allergen is placed on the skin. The scratch test involves making several scratches and inserting a small amount of allergen in the scratches. Bacterial and fungal tests, procedures in which samples from skin lesions are taken to determine the presence of bacterial infection or fungal growth. Fluorescein angiography. Fluorescein, a contrast substance, is injected intravenously and the movement of blood in the back of the eye is observed by ophthalmoscopy. It is used to detect diabetic or hypertensive retinopathy and also degeneration of the macular or central area of the retina. Ophthalmoscopy is the visual examination of the interior of the eye. Otoscopy, the visual examination of the interior of the ear to the eardrum. Skin biopsy, procedure in which samples of skin lesions are removed and sent to the pathology laboratory for microscopic examination. Slit lamp microscopy, examination of the anterior eye structures, such as the cornea, using an instrument that projects intense light through a narrow opening for optimal visualization. And a tuning fork test, procedure in which a vibration source, a tuning fork, is placed in front of the opening to the ear to test air conduction of sound waves. The tuning fork is also placed on the mastoid bone behind the ear to test bone conduction of sound waves. Abbreviations, we have ENT, which is ears, nose, and throat. Then we have HEENT, head, eyes, ears, nose, and throat. PERLA, pupils equal, round, reactive to light and accommodation. VA is visual acuity, the clarity of vision. And VF is visual field.